I'm going to move on to the next presenter, who is Magnus Conteh. He's the Health Programme Coordinator with World Vision Ireland. And one of the programmes he's involved in, which I'm glad to say the Centre for Global Health is also a partner in, is working with the Ministries of Health in Kenya, Uganda, Tanzania, Mauritania and Sierra Leone. And this particular project involves working with frontline workers, community health committees and also advocacy groups. He's also, within World Vision, a strategic lead on the development of mHealth in Sierra Leone and is a member of the World Vision mHealth Steering Committee. He's held a number of senior management positions within the health service, both within the UK and within Ireland. Magnus.
Thank you, Mark. It's a pleasure being here and presenting on this particular topic. I have a responsibility for managing our health programs in East and West Africa and the countries that Mark has just mentioned. I'm based here in Dublin. I work with World Vision Ireland. The program that I would like to focus on today on this presentation is a maternal and child health program that we're currently implementing in these 5 countries. And it's funded by Irish Aid. It's mHealth program, which means the first acronym there, it means access infant to maternal and then health, of course. We have a very ambitious program, but a program which, without a doubt, those of you who are involved in maternal and child health will realize that it's a program that is required in these countries that I've just mentioned because of the very high maternal and child mortality rates. Our target is a 25% reduction in infant mortality rate, very ambitious target, but one that we are gradually working towards. It's a 5-year program. We are now at the end of the 3rd year and the 4th year and entering the 5th and final year, although we already have an extension for 2016 with the possibility of another 4-year round of funding from 2017 to 2016. Sorry, 17 to 2020. I don't want to focus too much on the maternal and child health program itself, but rather what we have done to leverage mHealth or mobile phones as a way of communicating with our beneficiaries, collecting data for monitoring and evaluation purposes, but also syncing that data that is collected at the household with the data collection system, the DHIS system of the Ministries of Health. We take a 360-degree approach towards behavior change within the communities that we work with, particularly in terms of pregnant women and their families. And you will see that, and those of you who work in this context will recognize that the decisions that pregnant women make at the household are influenced by a whole host of people and institutions, organizations. So you have the teachers, caregivers, traditional leaders, religious leaders, government policies, the health system, socio-cultural practices, all impacting on the decisions that the individual makes at the household. So we intervene in the household through our community health workers who we train to deliver health messages at the household. We also intervene at the community level through our community health committees with a huge capacity building approach, and also at the environmental level to influence policy making using a citizen voice and action, which is an advocacy approach. From this diagram, you can see that World Vision cannot do this alone. And certainly we need to work with partners at all levels, at governmental level, at the donor level, but also at the community level, and of course, within families and households. You're all aware of the deep penetration of mobile phones. Some of these communities where we work in have more mobile phones. They have access to mobile phones, but do not even have access to electricity or water supply. So why don't we leverage that access to the last mile and reach these people in the communities that we work with, but also use that as a way of linking them with the health systems itself. So we made a conscious decision to pilot this project first in Sierra Leone with a small group within the district that we work in. And in making that decision, we had to step back and think, how do we get this pilot project off the ground? Because we wanted to plan not just for piloting, but also for taking this to scale. If you don't plan for taking things to scale, you will find that maybe when you come to the end of your pilot project, you have not adequately planned to take your project to scale. So we spoke to our donors. We got funding from Irish Aid as part of our maternal and child health programming. We also collaborated with our colleagues in the UK, World Vision UK, through their DFID funding from the UK government, and also the Gates Foundation based in the US. Through the Gates Foundation, we were invited to join a collaboration of Gremlin Foundation, who have the Motec Suite platform that is used as part of community health worker programming toolkit to program mobile phones to collect data. So they are a platform developer. And with DeMaggie, who are also a software application developer, which sits on top of the Motec Suite and allows for data to be collected and sent to the Ministry of Health. And of course, our international office in the US was part of that, MOU. So we got the donors coming together and supporting this project. And also then within the country itself that we work in Sierra Leone, just taking one step back, the implementation of this program, the maternal and child health program, is actually done through the Ministry of Health. So World Vision is facilitating the implementation of the program, providing the financial support through our donor funding, and also providing technical capacity building for the Ministry of Health, for community health workers, as well as for other civil society organizations that are involved in advocacy work. At the district level, we have the DHMT, the District Health Management Team, the district council, the district and local councils. Those of you who are familiar with work in a lot of these countries that I've just mentioned would know that there are devolved governments now, and these devolved governments allow local councils and the local ministries of health to make decisions that are beneficial for their local communities depending on their requirements. So it was important that we work with them as well. As you can see, the Ministry of Health has the governance and health policy responsibility, but actually implementation of those policies is done at the local level. And then, of course, how can we forget our beneficiaries? We have to partner with them. We don't just go in and do something to them. We actually do partner with them and take them into consideration as we plan our programs. Because we are talking here about use of mobile phones, you're talking about information and communication systems here. And we felt it was important that we bring in the Ministry of Information and Communication to ensure that we understand what their strategies were, what their policies were, and how we fit into that framework. So that's the governmental level. And you know, you think about the amount of data collected with the mobile phones from our communities. This data is very sensitive health data, and that needs to be managed very carefully. So we wanted to ensure that whatever we were doing, that we acted within the regulatory framework of the network service provider. So we also engaged with the network service provider to understand the existing data protection issues in the country, but also the regulatory issues with the network service providers to ensure that we are partnering with a network service provider that falls within the requirements of the telecom regulator. And then we also made another conscious decision to look at the area that we're working in, which of the network service provider had the greatest coverage in that area. And also, of course, what were their ethos, whether in fact there was an alignment in terms of their corporate social responsibility, their corporate engagement with the Ministry of Health and the local communities, and alignment with our own interest as an international NGO. So we identified Airtel, but of course, it was quite a sensitive and challenging engagement because World Vision, although we have an ICT for D department, we didn't have the good understanding of how these network service providers operate. And through our collaboration with the Gates Foundation, one of their consultants was able to work with us to identify the technical requirement of our programming and see if Airtel could match that requirement. So we actually engaged with them at that level as well. And then, of course, within Sierra Leone, the National mHealth Coordinating Committee as well, which has other stakeholders within the mHealth ecosystem, we also consulted with them and engaged them in the process. And importantly, at the very outset, we had an academic relationship already built with the Center for Global Health in our maternal and child health programming, and we engaged with one of their PhD students to be involved in conducting operations research or implementations research during this. So this is how we built this partnership. It was quite a comprehensive piece of work, but done over a year and a half. And we can say now at this stage, we are confident that with the pilot that we are doing, we are now ready to go to scale. The indication clearly is that the use of mobile phone is going to enhance our communication and engagement with the beneficiaries, but also we can collect data and connect the community health systems with the health systems itself. I know I'm out of time, but I'll just finish by just showing you some pictures here of our discussions with the MAGI, the network service, sorry, the software developers that we met in DC and had a meeting with them. A representative consultant from Gates Foundation who has a history with the network service provider systems, and Frederick from the Center for Global Health. We then met with the Ministry of Health in Sierra Leone, and then, of course, with Airtel, having a meeting with their technical department first, before we engage with their corporate leadership. When we went to negotiate our, at the scale-up stage, the costing and pricing for the network service provision for when we go to scale, we brought the Deputy Minister of Health in Sierra Leone to that discussion. And at that stage, we informed Airtel as well that it's no longer a negotiation with World Vision. It was now a negotiation with the government of Sierra Leone, represented by the Deputy Minister of Health. And that took the negotiation to a different level. And of course, they very quickly brought in their senior corporate people and engaged in the type of negotiations that could bring in their corporate social responsibility, but also the fact that they were already supporting other health programs, and to see how that partnership could be transferred into this partnership with them that we are trying to develop. So it was quite a comprehensive negotiation and partnership building. And of course, World Vision has quite a clear mandate in terms of partnering with various institutions and organizations, because World Vision is a federated system, in fact, internationally, working in over 100 countries. My slide will be available, or my presentation will be available on the website, I believe, for those slides that I've not been able to go through. It's important that we are able to reach the last mile, but to do that, you have to breach the last mile. You have to breach the barrier to get to the last mile. And to do that, you need to collaborate with other institutions and other organizations that already have the engagement at that level, or can bring in the technology that will help you to reach that last mile. Thank you.
Okay, thank you so much, Magnus. Any questions, clarification? Two?
Thank you, Magnus. That was a great presentation. My name is Ciara Heaven. I'm from the Health Information Systems Research Centre in University College Cork. So I suppose my questions are maybe a bit technical in a way. I suppose it would be really interesting to understand the functionality, the features of the health technologies that you've implemented to date. I suppose there wasn't enough time to provide that level of detail. And I suppose just in terms of our own experience working with African partners and the Ministry of Health, can you outline some of the technical difficulties that you may have experienced along the way in terms of integrating or bridging the gap between your health technologies and the technologies that are in place in some of the countries that you're engaging with?
Thank you so much for your wonderful presentation. My name is Lillian Gamar, and I'm working with Concern Worldwide. I'm just interested to know, in terms of sustainability of health programs, I know a lot of work has been done in these programs in health, but then what's striking is the sustainability after organizations leave. For instance, you've mentioned that you went for the negotiations at Airtel with the I think high-level personnel from Minister of Health. So what's their take, like Minister of Health? What next after this? What's the sustainability plan? Thank you.
Great.
So can I just remind you, these are questions of clarification.
Sure.
So if you can give very brief answers, that would be great.
Okay. In terms of the functionality, we really do not have enough time to go into that, but I'll just mention 3 key areas. The first one is being able to register the pregnant women. So when our community health workers go into the household, they're able to use the phone with the ComCare application to register the pregnant women onto the program. The other functionality is in terms of reminder messages for our community health workers in terms of appointments that they have, because we do a range of household visits. Our community health workers have scheduled visits over the pregnancy period of the woman. And therefore, the functionality of the phone is able to remind them of when these visits are due. Another functionality is messaging, SMS messaging directly to the household, to the pregnant women, reminding them of appointments that they have, but sometimes giving them clinical advice, but also video messaging that goes as well to the households. That aspect of it is still under development, the video messaging aspect. And all of this is done in the local languages. It's very contextualized for the local communities. The technology integration is a key one, because one of the things that we focus on for World Vision is community system strengthening. But increasingly what we realize also is that the health system strengthening component should not be left out. But with all this data that we are collecting, it needs to be integrated into the Ministry of Health data collection system. In these countries that I've spoken about, predominantly they use the DHIS2 system. And the ComCare application has now been redesigned to communicate directly with the DHIS system. So as the data is collected, it is transferred immediately into the DHIS system of the Ministry of Health. And that data is stored and then, of course, analyzed and developed. What we have found is that those systems are not very robust. So as part of our scale-up planning, we've already costed, for the case of Sierra Leone, how do we develop those systems further and build the capacity of the Ministry of Health to support that system. The final question about sustainability of mHealth. As you can see, the range of partners that we have in this process, right down from the grassroots to the donors, we have ensured that from the design phase, we take sustainability into account, which is why when we are negotiating with Airtel, we didn't just go as World Vision with donor money to pay for this. We did that during the pilot phase because it wasn't big enough to attract Airtel as a commercial entity. Remember, they are a commercial entity. They are for-profit organization. They have to make their profit. They buy services. They buy goods and services to provide the service that they give to us. Because of that, we brought the government, we brought the Ministry of Health, because we wanted the Ministry of Health to take ownership for the program. And by doing that now, the ministry is able to negotiate an affordable rate. And of course, Airtel are able to use their corporate social responsibility funding to provide a reasonable pricing for the government. And by the capacity, through the capacity building effort that we are doing, we are making sure that this will be sustainable once the grant comes to an end. I hope that answers the question.